I'm Dr. Hagglund, and today I'd like to talk to you about something that many of us have forgotten about. We don't stress it enough, and that's a gland right here at the base of your throat. It's called the thyroid gland, and it's responsible. Listen to its job, and then you'll know why it's number one, the top of the list is something you should pay attention to. Because you know there's maybe 50 million people out there that are suffering from a condition of low thyroid. And many of them don't know it. This gland, it turns out, puts out a hormone into your body that controls the speed, controls the rate or the speed at which your cells operate. 73 trillion cells that have all got to pay and have all got to move at the same rate. Let's pretend you're in a marching band, okay? And if we didn't have a drum section, and if we didn't have the leader of that band, somebody telling the liver, somebody telling the muscles, the brain, and all the rest of the body at what speed to operate. Okay, so one doesn't get ahead of the other and run out of stuff, etc., etc. That's the thyroid. So now I think you understand that you need to know what's going on there. Now there's a little burp in the problem there of trying to figure out what's going on with your thyroid. It's called the blood test, because many of my patients have heard me on the radio tell them, go get some thyroid test, all right? One of the best ones is a saliva test. The blood test has got problems. The reason the blood test doesn't work so well is that it's measuring a thyroid in your bloodstream, and it does it very accurately, but that thyroid in your bloodstream is called T4. It's thyroid with 4 iodines on it. It's called T4, and that doesn't do anything, okay? It's like a bullet in a gun that's had the lead cut off of it. Yeah, you can fire the gun, but there's no bullet coming out the end. T4 and how much is in the bloodstream is only important if I can tell you what's going on in the cells. And how are you going to measure that? You have to know how to measure T3. And the T3 is so valuable, it doesn't float around in the bloodstream very much. Yeah, there's a little bit out there, but it doesn't float around in there very much. You want to know what's in the cells. Saliva comes from the cells, so a good saliva test helps me understand where my patients are as far as low thyroid. But you know what else does? The old gold standard in medicine. The history, and then the physical examination. Now there's 46 symptoms of low thyroid. And I don't want to go through all of these with you, but it starts from the top of the head and goes all the way down to the feet. So it's brain fog, it's fatigue, it's insomnia, it's mood changes, it's high anxiety, it's blurred vision. See what I mean? It's thinning hair, it's thinning nails, it's dry skin. And then from there, it's stiff joints, it's achy joints, it's constipation, it's insomnia, it's loss of libido. Most time, women go through very expensive workups to find out why they can't get pregnant. And sadly, one of the tests is this TSH test, which is supposedly the best one we've got, misses their thyroid and misses the fact that they don't have enough thyroid in their body to cause them to ovulate, but more importantly, to carry that pregnancy to term. So when you understand the thyroid hormone, okay, and then you start to listen to the symptoms of these patients, which I've already gone through, and then you take a look at them. Their eyebrows are missing out to the side. Their hair is kind of baby thin. When you look into it from the top, you see that it's a very thin quality. You can see through the hair. Then you check the nails. Oh, and then you have them take a hold of your arm here. And if you feel how cold their hands are, I've often thought that a minister could diagnose as much thyroid in a week as I do, because he shakes hands with everybody as they leave church. And sure enough, all those hands come forward, all those cold feet and all that constipation, all those other problems that come up because your thyroid's too low. What's the answer? Look at yourself, listen to your body, and then you might make a therapeutic trial. This is where we give you something to correct the thyroid. Okay, in this case we have a product that you can buy over the counter. It's called Thyro-Pak. Thyro-Pak. You can get that product and then you can couple it up with some iodine. Now, not the iodine that's in iodized salt. That doesn't absorb very well. But if you couple it up with some iodine that really works, about 6 milligrams of something called Thyro-Pak iodine, or if you want to, get some iodoral, whatever the deal is, start feeding your body the iodine, then you hook up with the Thyro-Pak, all right? Now you're going to get a good therapeutic test and see what happens. You can have your doctor supervise this. You can tell him you're doing it. Now here's what I've also told my patients, because it keeps them out of trouble. The one thing that doctors worry about when we give thyroid is that you might give too much and you speed up the heart and cause problems around the body. You can avoid that. Take your pulse about 2 o'clock in the afternoon and see that it's under 88. If it's under 88, okay, while you're on the thyroid, which I recommend you give at noon in the Thyro-Pak dose, I'd like to see you take a half a tablet or a full tablet at noon, because your thyroid goes off duty at 3 o'clock, and that thyroid tablet that all of your doctors give you only lasts for about 4 hours, maybe 5 hours. So if you take it in the morning, you're not going to have it at 3 o'clock when you really need it.